President Joe Biden says COVID-19 will no longer control our lives. In his State of the Union address, the president laid out his plan to move past the pandemic while trying to prevent major outbreaks of variants in the future. And join me now is Dr. Jerome Adams, Executive Director of Health Equity Initiatives, Presidential Fellow and Distinguished Professor of Practice at Purdue University, and former U.S. Surgeon General. Dr. Adams, thank you so much for joining us today. We appreciate it.
Really good to be here with you.
Well, last night in his State of the Union address, President Biden laid out 4 criteria to move on from the pandemic, including vaccinations, preparing for new variants, preventing shutdowns of businesses and schools, and also vaccinations, as we mentioned. Your thoughts on that?
Well, I thought the president laid out a pathway forward that is really a roadmap for America. But one of the things that I think was lacking was a little bit more substance as to how we were going to engage to get people vaccinated and boosted. I want to remind folks that right now, especially in a world where fewer people are masking, the best protection we have against spread and against severe disease and death is vaccinations and boosting. Yet we have vaccination rates, adult vaccination rates, which are far below other wealthy nations, and booster rates, which are about half of the booster rates in much of Europe. So we've got a lot more work to do, particularly in that space.
Absolutely. And the president also mentioned not just vaccinating the U.S., but also the world. I want to get your thoughts on that and how it relates to health equity.
Well, health equity is about making sure everyone has the tools that they need to be able to make healthy choices. Unfortunately, many people around the country haven't had the luxury that we've had of being able to have 3 vaccines that are highly effective. It's a luxury to be able to say, I don't want to get vaccinated. And many places across the world don't have that. These variants are going to continue to pop up until we get most of the world sufficiently immunized. And so we aren't going to be done with the pandemic until we actually promote vaccine equity.
And another thing I want to turn to, an epidemic that's killing Americans, in particular teens, at an alarming rate, and that's the opioid epidemic being fueled by fentanyl. Can you talk to us about the seriousness of that and also what parents can do?
Well, I've been working with the Bipartisan Policy Committee to help Congress understand steps that they can take to help us respond to the epidemic. We know we saw a 30% increase in overdose deaths last year, a 40% increase among African Americans. They had the highest increase percentage-wise of any group. And we know that our First Nation, our Native American brothers and sisters, actually had the highest overdose rates overall of anyone. Truly tragic in many cases because of fentanyl that's contaminating not only heroin, but also methamphetamine and other counterfeit pills out there. So to parents, talk to your children, talk to your teenagers, talk to your college students about the dangers of fentanyl. Make sure they understand that even a counterfeit pill that they think is something else could have fentanyl in it. And all it takes is one mistake and you could end up dead. You could end up in the morgue. We don't want that to happen to anyone. And as Surgeon General, I put out an advisory calling on all Americans to know about and be willing to carry naloxone, an opioid overdose reversal agent that really can help people if they do have a mistake, a slip up, to not let it be their last mistake that they've ever made.
Yeah, it is very, very concerning. Before we let you go, though, I want to talk about the book that you have that's coming out this summer. Can you quickly tell us about that?
Well, it's called Surviving COVID, and it's really about helping people understand that apart from the politics, apart from all the confusion out there, there are things that will help us live successfully with COVID. I actually like to make things simple. I think of MTV, masking, and we know that whether or not you're mandated, wearing a high-quality mask can still protect you even against new variants. Testing and treatment, and President Biden talked about making it easier for people to get tested and treated last night, and then vaccinations and boosters. So MTV, if we follow those things, we'll be able to live with COVID. As long as we continue to resist those things, we're going to continue to see new variants and new surges.
Well, Dr. Adams, great talking with you. Thank you so much for your time today.
Thank you. I appreciate it. We've got the tools. We've got to use them. Let's work together.